Hello everybody, and welcome to another video of Let's Talk Upper Cervical. I have here with me today Vickie Dudley. She's been a patient of Dr. Scott Baker's now for about 8 or 9 months. And she's going to tell you about her experience with Dr. Scott Baker and getting the upper cervical care. And if you would, Vickie, just tell the audience out there what you suffer from and what the upper cervical care did for you.
Okay. I have suffered from anxiety since the time that I was a little child, probably around 7, whenever I started to notice the problems, and it has gotten progressively worse as I've gotten older. The last probably 10 years has been very bad, and I met Dr. Baker at a health fair that we had where I work, and he told me about some of the benefits that I could see from the upper cervical care, which I don't believe that anxiety was mentioned at the time, but there was other problems that I did suffer from, and I thought this would be a great chance to go in and get these taken care of. But what I was surprised to find was that after my first treatment, I found that my anxiety was pretty much gone. I mean, after about 2 days, and then I'd say a week later there was no anxiety, and I have been pretty much anxiety free except for the occasion when I go back out as far as my upper cervical is concerned, and I come in and see Dr. Baker. He adjusts me, and the anxiety is once again gone.
Wow, what was it like living with anxiety for so long? You said it began at the age of 7. What was that feeling that you would have on a daily basis?
I would wake up in the mornings and immediately, I mean, it wasn't that I would wake up and as the day progressed things would start to get fear, or I would start to have feelings of fear, but it was like an immediate thing in the mornings when I would awake, just this gripping fear, and this fear would just pretty much stay with me throughout the day. As far as living a normal life, that was not possible. I mean, because you spend the entire day fearing what's going to happen next, or fearing what this doom feeling that you have, and you don't know where it's coming from, and it's just a very terrible way to live. And
you had phobias that would start to happen, and you've had a lot of phobias from what you said, and they're all gone at this point.
Yes. Yes, I've had so many phobias over my lifetime because I think what I did was I tried to find somewhere to place that fear. And so I would develop these phobias of everything from storms to snakes to spiders, and I mean, and it wasn't just your normal, oh, here's a spider, it's creepy. This was, I would lay in bed at nighttime and think, I know there's a spider somewhere in this room, and I would be absolutely terrified. And so it was very debilitating. So
you're saying in the matter of 2 days you noticed a big difference in the way you felt on a daily basis?
Yes.
2 days after your first visit with Dr. Baker, right?
Yes.
Okay.
Yes. 2 days after my first visit, I went shopping with my daughter, and we stayed out the entire day, and my daughter was impressed at how well I was doing.
And you're now off of all the medications that you've taken in the past?
Yes.
You're medication free?
I am totally medication free for the first time in probably 25 years.
Wow.
Yes.
Wow. And you're living a healthy life, you feel great, and well, for those out there that are suffering from severe anxiety, what would you tell those people?
I would definitely recommend upper cervical care. I mean, like I said before, I did not come in for the upper cervical as far as the anxiety goes, but if nothing else, if I had not benefited from any other improvements in my body, which I did, there were a lot of other things that I did see improvements, but if there was no other improvements except for the improvement with anxiety, it's totally worth it. I mean, it has changed my life.
Wow. Well, thank you, Vickie, for joining us for this video, and thank you for viewers for watching. Please watch more of our videos on YouTube for Let's Talk Upper Cervical.